Now that there's been a little time to digest the information, talk to me about what stands out most to you in the governor's decision and the implications for the city of Atlanta and statewide.
The thing that stands out most for me is just really the businesses that were carved out. When you think about hair salons and barbershops and nail salons and any number of these are businesses that require that you be in close contact with people in order to provide the services. So I'm extremely concerned about the carve out. And what I think is that people really have to use their best judgment and exercise their common sense. And the science says that it is too soon for us to come in close contact with one another because we are not out of the woods as a country. My biggest concern right now is that we will see an even worse scenario than what we've had, because I think a lot of the success that we've seen in the city and quite frankly throughout this state has been because we were very aggressive in shutting things down. When you look at Bibb County around Macon and you see where our spike is happening in the state, that's an area that did not take aggressive measures and did not close down. And you're seeing the numbers bear that out. So I hope that I am wrong. I hope that the governor is right about this. But when I look at the science and talk with the healthcare professionals, I don't see the reasoning behind it.
You talked about the science. I think that is the big question when we look at the models that are available. That is based on limited testing, and we have been told by the state it's also about a 2-week delay. So hard to even know what science is supporting this for us.
There's so many unknowns. When I looked at the numbers last night, our 7 p.m. numbers from last night showed that we had a nearly 14% spike in deaths and almost 7% spike in those testing positive. And again, that's without people with mild symptoms and people who are asymptomatic being tested. And there nobody wants us to have to stay in a day longer than we have to. But I think that when you balance the economics of it and you balance it with public health, there is no balance there. This is They call it the novel coronavirus for a reason because there's so many unknowns. And while we have hospital capacity in metro area, we have it because we've been aggressive. And when you have healthcare workers saying, please stay home to make our jobs easier, I think we have to heed those warnings. And so, I could perhaps see allowing some other essential businesses to open, like doctors' offices and places like that, where people are trained and they know the risk and can take the proper healthcare precautions with the proper equipment. But I can't reconcile the logic behind opening a bowling alley.
Talk about the balance from your perspective on public health decisions versus economic impact decisions.
Well, had a great conversation with my mother, who I talk to multiple times a day. But my mother owned a hair salon for 25 years. And to close her business for 5 weeks or longer would have been devastating to our family economically. But my mother said to me last night, there's no way I would stand over a client during a time like this. And I think that is really what people have to balance, making money versus public health. And again, I understand people are making decisions based on how they will pay their bills and feed their families. Those decisions are very real. But I think that's why it's incumbent upon us as leaders to make decisions that allow people not to have to balance between the two. We're launching a beauty and barbershop fund today in the city of Atlanta to help people in the beauty industry to make it a little easier for them to stay home. We launched our small business loan fund before the federal government did to help make it easier for people to stay home. I think we need to put our energy into making it easier for people to apply for unemployment, to make sure that those stimulus checks are in their bank accounts. Those are the decisions that I think we need to put our energy towards. And taking our foot off the pedal right now, I just don't think it's a sound decision. The best example I received was from Dr. Carlos Del Rio at Emory University. And he said it's like climbing Mount Everest. As many people die headed up to the peak as die coming off of the peak. So just because we've made it to a peak, perhaps, doesn't mean that we're out of the woods. And also, my understanding is just because we reach one peak doesn't mean that we won't reach another when it comes to this virus.
That was going to be my next question about how concerned are you about a second wave as we reopen?
I'm extremely concerned, and that concern is shared by business owners throughout this city. I just heard from a restaurant owner who owns one of the busiest restaurants in our city, who said that he thinks it would be reckless to open his business back up, and people are concerned about putting their workers at risk. And I think that when you look at the science, and when you look at what the professionals have to say, not what I have to say as mayor or as a lawyer, not what anyone else has to say, but what the healthcare professionals have to say. They're saying we are not out of the woods, and for us to take our foot off of the pedal may cause us even more harm than we've seen thus far. We have been very fortunate in the city that we've not seen our healthcare system overrun in the way that other places have. But the reason we've been so fortunate is because we exercise common sense. We looked at the data and we shut the city down. Other metro area cities shut their cities down. When you look at the population in the metro area, we have more than half of the population in the state, but less than half of the infections in the state because we've been aggressive. And to take away our ability to really do what's best on behalf of our communities, I think puts us all at risk.
Yeah, is there a feeling of helplessness because it was made clear that this is a statewide order and that cities and counties can't make changes within it?
I don't feel helpless. I feel that we are still empowered to use our voices and to use our common sense. And that's what I will continue to do as mayor. And I have a good working relationship with the governor. And I know that that will continue, but on this, we disagree. And his authority as governor is what it is. And it certainly supersedes my authority as mayor on paper, but it doesn't supersede my voice. And I will continue to use my voice to urge our communities, our business owners, and our residents to stay in. No sooner than the governor's order came down yesterday, my 18-year-old ran in the room and told me the governor said he could leave the house. And his birthday is today. So he's feeling very empowered. But I reminded him if he left, he needed to take enough clothing with him to stay throughout the pandemic because he could not come back here. And these are the tough conversations that we have to have inside our homes and with our communities. And this tough conversation is it's not time yet. The science and the data then show that we are out of the woods. We just have to use our common sense. And for those of us who are fortunate enough not to have to figure out how we're going to put food on our table and pay our bills, then I think it's incumbent upon us to step up and stand in the gap for some people who may be in need. It's why we're continuing our food delivery services in the city of Atlanta. It's why we're doing what we're doing related to small businesses. And we'll just continue to call on others to help us with that.
Your conversations with the other mayors around Georgia, have you had a chance to talk to a lot of other mayors, and what has the consensus been in those conversations?
I spoke with Mayor Hardy Davis from Augusta last night, who is the mayor of the second largest city in the state. Mayor Davis wanted to know if I'd heard from the governor. I told him I had not. He had not spoken with him. I've heard from other mayors, some of our smaller cities, Vince Williams and Union City. We're all asking the same questions. And I've seen other mayors on television last night and today. And I think by and large, people are very confused by this and really concerned that our input as local leaders was not sought. And again, The governor doesn't have to ever pick up the phone and call me. He's the governor. He is authorized to make decisions and doesn't have to consult with any of us. But to the extent that we have to explain this to our communities and it impacts what could be a public health crisis in our communities, then certainly we have to make decisions that we feel are appropriate for the people who have elected us to lead them. And that decision for me is to say, I think that opening up businesses right now is a not in the best interest of the people of Atlanta. And I really encourage people to please continue to stay home.
I'm going to just have two more quick questions, Mayor Bottoms, because I know your time is in demand. Have you had a chance to talk with any of the big hospitals in your city about this decision?
Not about this decision specifically. Again, I speak with Dr. Del Rio or communicate with him almost daily. I've spoken with him. Dr. Sanjay Gupta and I were in communications last night. And again, I've not heard of anyone who thinks that this is a decision that's based on the best interest of public health in our state.
Because I've been talking to some nurses and doctors, and you know, there have been enough beds, but they are still stressed. It has still been incredibly difficult. They still don't have all the PPE they need, and so they just kind of last night could feel like, oh gosh, what is this going to look like for us?
And again, just because we have enough beds doesn't mean that we should work to fill them up. Our healthcare system is stressed on a normal day. Grady Hospital is a major trauma center in the Southeast. Just a few days ago, we were 31 patients over capacity. This is stressful for our healthcare workers. And Grady struggles with capacity issues when there's not a pandemic. And so simply because we have additional beds doesn't mean that we can ease up because we can send more people into the hospital, because the reality is this, especially in the African American community, many people are going in and they are not getting out of the hospital. They are dying. We have some of the highest asthma rates in the country, diabetes, high blood pressure, lupus, respiratory issues. These are things that are common ailments in the African American community, especially, and in an urban center like Atlanta. And these are the underlying conditions, obesity, that are causing people to die when they are infected with this virus.
That's such an important point, because I have seen that conversation very passionately in the last few hours about concerns that just as this virus has disproportionately affected the African American community, a decision to reopen, if it is indeed too soon, would also disproportionately affect that community as well.
It certainly would, because there are a number of hair salons in our communities and barbershops. And these are people who quite often don't have health insurance. And so you have barbers and hairstylists who are standing over customers. You can't socially distance when you are doing someone's hair, or when you're cutting their hair, or when you're doing their nails. And we can't assume that if the city of Atlanta is having challenges getting PPE, then what's our expectations for our barbers and our hairstylists? As far as I know, there's not even been any public health training for them as to what's the appropriate PPE when you're standing inches from someone's face. It doesn't make sense to me. And I can't stress enough, I understand the economics of it is a huge factor, but you can't enjoy the economic benefits if you're dead.
Final thought, you know, as we're both moms of four, what keeps you up at night?
What keeps me up at night, it really, any mom, my kids, and all four of my children have asthma. And even each time I go to the grocery store, I'm so concerned about what I may bring into my household. My youngest son has had pneumonia before. You know, he has the most severe asthma of them all. And so I'm constantly concerned about what if we inadvertently bring something into our house while we're out buying groceries.
Mhm.
And that's the thing that keeps me up at night. And of course, I think about my mother and my mother-in-law. And, just by virtue of their age, my mother-in-law has some underlying health conditions, and my mother is in good health. But when I look at one of my dear friend's mothers who spent nearly 15 days on the ventilator, she was in good health too. So I know that for our seniors, they are especially vulnerable. And for our children with underlying health conditions, this could prove to be deadly.
Mayor Bottoms, thank you. Thank you for the time. We really appreciate it. And I know we'll be in touch. So thank you.
Thank you.
All right. Take care.
Thank you.
Thanks, Mayor Bottoms.